the unceded territory of the Squamish, Tsleil-Waututh, and Musqueam Nations, on whose land the main council office is sitting on today. I'm joining here from Kamloops, BC, and I know we've got folks from all over the province with us, so welcome. We're really excited about today's call, and we've got some neat stuff to share with you. As we get going today, we wanted to start by welcoming you and inviting you to introduce yourself in the chat box. So the chat box right now, if you haven't used it before, on the bottom right-hand side, and you can actually just send a note to everyone. When you do so, make sure you select in the send to box all participants so that everyone can see your message and we can all answer back to you. So we really encourage you to use that chat box today, and we'll take it from there. The other thing we're going to do today is this is going to be interactive, so get ready to have your hands on your keyboards, and we're going to have a chance to do some things with Sonya. She's going to invite us to ask questions. And rather than going to the chat box or using a separate whiteboard, we're actually going to have some writing right on top of the board. So we're actually going to have people writing right onto Sonya's slides. So if you've never done that before, you can see on the top left-hand side of the screen, there's a T. It's called the text tool. If you select the text tool and then go over 1, 2, 3, 4 more and pick a color, you can actually write right on the slides. So I don't know if people want to give a chance right now and say good morning right on the slide so you can see how that's done if you haven't done that before. I just popped a little note there. So again, just grab the T, pick a color, and you can say good morning or hello or whatever you like on the screen right now. See, there you guys, you're all seasoned, experienced at this. So Sonya is going to get you to lay hands on your keyboard a few times today. So watch for that and those exciting opportunities today. We are recording today's session, so just wanted to share that with you. We will be recording it and sending out the slides as well as the recording in our future newsletter. And before we get started, I wanted to introduce myself. I'm Colleen Kennedy, Director of Innovation and Engagement with the BC Patient Safety Quality Council, and delighted to be here today. I'm going to hand it over to my partner in crime, Danielle, who's also going to introduce herself. Go ahead, Danielle.
Hi, everyone. Thanks so much for joining us today. My name is Danielle Simpson, and I'm the Leader of Innovation and Engagement here at the BC Patient Safety Quality Council.
Great, thanks a lot. So Danielle will be chatting, and I will be chatting with you a little bit more. But before we got started, we really want to invite and welcome our guest speaker today, Sonya Chandler. You know, these CanBC network meetings are really by the network and for the network. So members of the network are doing amazing work around the province, and we really want to use these meetings to help showcase and promote the work that's happening. So the network members really determine the content of what we're doing, and Sonya is one of the members of our network and our core planning team. And so today we have the pleasure of welcoming Sonya to do a little presentation on what matters to her. Sonya is a quality and experience consultant with Island Health, but most importantly, you'll notice the #1 designation she has is a mom. She's also a wife, and as she describes herself, a 42-year-old perfectly imperfect human being. We're truly honored to have Sonya join us today, to have her share her story. And so thank you so much, Sonya, for joining us. And I'm going to hand the ball over to you now, and welcome to joining us today.
Thanks so much. And I really appreciate being here. I'm going to leave the camera facing at Colleen so you guys can all see my slides, and hopefully you can hear me well. If you've got any problem, obviously put it in the chat box if you can't hear me or something goes on with the slides that I can't see on my end. I'm going to start today just to take a moment to really raise my hands in acknowledgement to the people of the Coast Salish people of whose territory I live and work and where my kids go to school. The Songhees and Esquimalt Nations is where I've been situated for the last 20 years, and I just really want to express my gratitude and acknowledge that. So I raise my hands. Haichka. So the first thing I want to do is just get people to jump in right away. As Colleen was saying, I'm hoping that folks will take a minute to jot down what matters to them. In this very moment, I'm going to give you about 15 seconds. I just want you to throw up, we'll put this blank slide up. You can just put what comes right to the top of your mind, what matters to you right now. Go. I dare ya. Come on, Colleen, can you be first? Okay, perfect. Excellent. I love seeing this stuff popping up. All people equal always. My kids, heat, my furnace is broken. Finding somewhere to live, trust, people, lunch, me too. Learning, excellent. Amazing, you guys. Accessible health care. My kids' health and happiness, beautiful, love it. So, any 2 seconds more, we'll let people if they got a couple more things. Otherwise, I'm going to click ahead here. That's great. We'll just park that there for a second. Now, I had to do that because today is Valentine's Day, and you know, it's, as we all know, it's about love, and it's part of the connection today to what matters to us as being the topic for conversation. And when Colleen and I talked about what I could bring to today's session, I really, you know, I thought about my mom, and because she was a very important person to me. And so to explore a little bit about what matters to me, I'm going to tell you a bit about her and about how her death in 2013 really just inspired my journey of really connecting to myself. So when I think about what matters to me and what matters to my mom, it was really family and time together, fresh air, fresh food, laughter, song, prayer, movement. This is my mom. She, in so many ways, was an advocate, an activist, my cheerleader and so many other people's cheerleaders. She was a bold believer in possibility and in love. She walked softly on this earth and left a really amazing legacy of authenticity and courage and connection and kindness. Anybody who had met or had a chance to work with her would I'm sure, say the same. This is my beauty of a mom. She was a highly spiritual person, and she was sure that death was a continuation of this magical thing we call life. It was part of the cycle. And, you know, in many ways, she may have even looked forward to it as a bit of an adventure, as part of the big package. Death was something that we talked about a lot in our family. I remember my backyard was always filled with the skeletons of little birds or of frogs that she'd found, and was so fascinated by, you know, the beauty and the experience of their lives and then the ending of their lives. It was something that death was something she looked at with curiosity and acceptance, and really appreciated the beauty of, you know, things like autumn leaves and little things found around our yard that she would draw my attention to. Overall, I felt like we were pretty comfortable with the concept of death. But then she got sick. She was 65, and we were entirely unprepared for what the next 2 years would be about. Because honestly, we weren't dealing with death. We were dealing with, as it turned out, illness and uncertainty and suffering and the institutionalized healthcare system that we were sucked into out of fear and confusion. It was overwhelming. And I would say that ultimately my mom didn't really get to experience the adventure of her own death because she was too desperately trying to stay alive or to figure out what was going wrong. And now, my mom's case was really complicated. It wasn't simple. It was very complex, and we never really did figure out what was going on for her. But one thing is really for sure. As far as I can tell, nobody in the 2 years of us exploring what was happening, not one person asked her what mattered to her. It just didn't come up because everyone was just way too busy trying to figure out what was wrong with her, referring her to the next specialist, moving on to a diagnostic procedure or 5 or 10. No one really talked about death or end of life. It just didn't come up. And no one really talked about the quality of life that she was living. That's my mom there, and my beautiful daughter, Penelope. She was 7, I think. No, 6 in that picture. And my other daughter was 4 when she died. Okay. So I guess you might be wondering why, from a quality improvement perspective, I'm telling my mom's story. Well, this is a picture of her and I see our resemblance so strikingly there, a real connection, a continuity of our family. And I bring up this story today because, one, it's what brought me to quality improvement work in general. My mom's my mom's journey really connected me to needing to want to be involved in improvement, in making things better. And secondly, because it's shown me and really reminded me that healthcare improvement is about our shared human experience. It's about our shared suffering, our shared imperfections, something that I think we often forget in the busyness and the hecticness of figuring out what we're measuring and figuring out what the data says and making referrals and getting treatments and doing the testing, and we forget that it's about our shared experience of being human. So I'm going to ask you to think about that for a minute, and if you will, if you could just settle yourself in your chair and feel yourself sort of settling back against the back of your chair, feel your shoulders relax a little bit, feel your hips supported by your chair, and if you could, close your eyes. Now I'm slowing my voice down and taking a minute to just be still. And if you could take a big deep breath and blow it out slowly, kind of centering yourself, and let go of all the busyness that came before this session, because I know we were all in it. All of the to-do lists and the paper piled up on your desk, just blow it out. Just let it go. This stuff will be there for you when you go back to it. If you can take a minute to actually just check in with your heart beating. Just feel your heart beating. I'm always amazed when I take that minute. And when the busyness in your head comes back, just settle back for a second to that heartbeat. That place is where we connect to each other and where we connect to what matters to us, and where I believe we develop the courage to ask others what matters to them. So when you're ready, if you open your eyes or kind of come back to the present moment in front of you, and I'm going to ask you to once more on this whiteboard, just jot down, maybe in more depth, maybe something new, the things that matter to you. What matters when you feel your heart beating? Amazing. So I see a lot of stuff there about connection, stillness, peace. Excellent. So I'm going to pop us over now, and we're going to do, thank you for that, by the way, for slowing it down with me for a minute. It's really meaningful, and I appreciate it. This next is a poll, this next question. So I just want to find out, how often do you think you go to that place, sort of that quiet place of your true self, but really looking at the things that you connect with? How often? You can just take your little clicker bar, click on the T or maybe on the marker symbol, and you can just put a mark by where you think you land. I know I am probably occasionally. There we go. You can do it however you do. There we go. Perfect. Thanks, you guys. That's great. I found myself definitely around the occasionally mark, and even less when I'm working my full-time job, and I love my job, raising my kids, participating in my community, getting the car clean, getting my groceries done, all that stuff that we all do. And so I didn't have a heck of a lot of time where I got to do this. So I started thinking about ways to really find that time in my day, and especially when I'm at work, and I had a couple of ideas. The first one came to me when I ran into this organization. It's called Death Over Dinner, and after my experience with my mom, I had heard about them, and they were a group of medical and wellness leaders that came together and initiated this sort of campaign that invites people to gather and to share a meal and to talk about death and dying. It's an extremely well laid out website and service, and it was super encouraging. The idea of normalizing conversations about these real things like death and dying and all the decisions that come with that really appealed to me. Around the same time, I learned about this amazing project. It's called the Conversation Project. It has also an incredible website. It's a Institute for Healthcare Improvement supported initiative and has an amazing amount of resources. This website actually suggested that it's not only important for personal or emotional or spiritual reasons to have end-of-life care conversations, but it's actually, it's cost-saving and can really lead to improvements in healthcare across the board. That was amazing. So I did it. On my mom's 67th birthday, 2 years after she died, I hosted my first death over dinner, and it was totally amazing. I had about 20 people come over, and we set the table and shared a meal, and we laughed and cried, and we made plans and set intentions. It was fantastic, and I was super excited to share my story with my colleagues at work when I came back to work the next day. And so when I got to work and shared my story, it turned out that people were interested in doing it at work too. So at a bit of a whim, I sent out an email invite to my colleagues and booked a room, and we got together for a death over lunch. We shared some space, and I shared my mom's story, and we had an amazing connection. I shared the toolkit and the Conversation Project starter kit, and a lot of people took home some really great ideas for their families. Every person who participated sent me a note afterwards, and I'm certain that those conversations had an impact for people. It was great. My next example, having had that experience, I'm feeling so connected to the idea of finding space in my workday, is someone introduced this website to me. It's called Headspace, and I've put these links at the end of the presentation so you can check it out as well. And basically this offers 10 free 10-minute meditation sessions and a really handy little app you can use on your desktop or your phone. And so I sent out, kind of also on a whim, with right in the subject line, join me for mindful minutes, and I sent it out to my portfolio. And I have no idea how many people participated, but it was an amazing experience to walk through the portfolio and to see people sitting at their desks with their eyes closed and their little earbuds in, taking the time that they needed to have a few minutes of quiet space at their desk. A lot of gratitude for the nudge to be mindful at work. So I guess I say all this because what I've come to understand over the last few years after having lost my mom is that ultimately what matters to me and what matters to you actually matters. It's kind of amazing. And unless we figure out how to share this and actually how to speak about it and to weave it into the ways that we show up every day, then it won't ever really become what guides us as a culture, as a society, and as a system. I recently took a course online that I also included the link for at the end of this webinar through MIT, and it was called Leading from the Emerging Future, and it was based on the U Lab, or Theory U framework. And I highly recommend it. And one of the things that they said was the quality of the results that we create in any kind of a social system is a function of the quality of the awareness, the attention, and the consciousness that the participants in the system operate from. That blew my mind. I was like, wow, so you mean what matters to me actually matters? I couldn't believe it. And in the course, they say that the success of our actions as change makers actually doesn't depend so much on what we do, or at least not only what we do or how we do it, but also on the inner place from which we operate, which is what I wanted to talk to you guys about today and why I shared the story of my mom, because she is very much about, her story is very much about where I operate from, my inner place. So I think that's about it. I have included a couple of slides over some ideas for actions that you can take, and also the links of the things that I referred to. I will, leave some space for questions, and we'll invite you, if you have a chance, to go back and look at the whiteboard notes that you left today and consider where you may be able to take some of those things that have meaning and weave them into your day-to-day, both at home but also in your workplace, because it matters. Okay, that's it for me. Any questions are welcome.
Thank you so much, Sonya. for sharing such a personal story and how you've translated what matters to you into action. I think it's really thought-provoking and interesting to hear, and so really appreciate you sharing that part of yourself. I want to invite it out to people on the call now, if we can maybe unmute the lines, just to say if people have any questions, they're welcome to pop them in the chat box if there's any questions or observations you wanted to share, or feel free to pop up your hand and we can unmute your line for any questions at this stage. All right, lots of things coming in the chat box right now. Sonya, right now we don't have any questions. So if anyone has any questions, we will have some time at the very end for questions. Thanks for doing this, Sonya. And I think what you've reminded each of us, is that we all have things that matter to us in the work that we do, in our own care that we receive in the process. And I think your story is so inspiring because it shares that piece and reminds us how important this is. And in so many ways, you know, everyone is writing in the chat box how much they appreciate you sharing this, so thank you so much, Sonya. In so many ways, you know, we often lose sight of this as we are in our healthcare system and can forget to remember what matters to us or what matters to the people that we care for. And so today we really wanted to let you in on a little secret of something that's coming down the pipe. So we've got something new coming your way, and we wanted to give you a hint about it today. We're going to be launching a new campaign on February 21st. Today you're getting a sneak peek at it, but we wanted to share it with you. And it's something called What Matters to You Day. We're planning What Matters to You Day on June 6, 2017, and we wanted to tell you a little bit about what it's all about today. And Sonya's story really serves as the perfect segue to really thinking about this. So What Matters to You actually started in Norway in 2014 with the simple goal of encouraging patients and providers to have a simple conversation about what matters to them. And we really liked the idea. You know, it kind of started expanding. I was on a call last week. We had people from Brazil, Denmark, Scotland, Norway, and beyond. So that by last year, there was over 500 teams from 14 different countries that actually participated in this event. And so we're actually bringing it to BC thanks to a partnership with the Patient Voices Network, the Council, and other provincial partners. So we're really excited about this. Now, you're kind of getting the sneak peek at this because, as I mentioned, we're not going live yet until February 21st. But what is it all about? So What Matters to You Day is really about encouraging and supporting these meaningful conversations. So between the people who provide health care and the people who are receiving that care. It may even be a conversation between people who don't provide patient care at all directly and asking each other what matters to them, both in their work and in the care they provide. So we really think this is important when we look at our system today. We know that, you know, providing patients or person-centered care is important because it results in better outcomes for, you know, the patients, greater satisfaction in the care because they're partners in these discussions. So What Matters to You Day is all about really putting the patient and the family right at the center of care as we move forward in this work. So what does it look like? So this campaign that's coming is, what we're doing is on June 6th, 2017, we're inviting healthcare providers across BC to ask one simple question in every patient interaction they have, and that question is, what matters to you? So we wanted to give you a glimpse of what some of this has looked like in other countries and share some of the stories of what we've heard about what matters to you. We've heard about Sonya and what matters to her, what mattered to her mother, and how she's taken what matters and translated it into the work that she does every day as a provider in the system. We've also seen what matters to you apply to the patients who are receiving that care. If I draw your attention to the picture on the upper left-hand side of the screen right now, it's a patient with his horse. So this is actually a Swedish policeman and his police horse. And this was organized where his colleagues arranged to have his horse, his partner that he worked with for years, come to see him in his hospice bed. This important interaction was, this was a partner and his colleague in many ways for many years in the system. He worked alongside this horse. And what mattered to him at the end of his life was having the opportunity to see his horse again. What we see is some other examples here are from pediatric units in Scotland, where they invited children in a pediatric ward to actually write what matters to them above their beds, and then they posted them. So they had little notes saying what matters to them so that the people who came and cared for them had an opportunity to know what was important to those children that they were caring for. So I love this one with in the center where it says, no mooning, knock before you come into my room, and don't forget about me. Some of these important and seemingly simple things, but are so critical for people who are receiving care. So here's just a few examples from the palliative world, the acute care world. A couple more examples on the next page is really looking at what was done in the Glasgow Hospital. So this is Glasgow's Royal Children's Hospital, where they had these walls created on every single unit in the hospital, which invited the patients that were in their care to actually indicate what matters to them and post that in a really visible way across their unit and to share what was important to them. The international examples extended. So in Scotland, this became something that was used both in healthcare but also social care, in schools, et cetera. So on the left-hand side here, we see some children. And what some of the schools did was created these trees. And they used these trees as a way of gathering and capturing what matters to people. So invited people to share what matters to them, invited people to kind of highlight what matters to them. In this case, invited children to list some of the things that matter to them in their day-to-day life. On the right-hand side, we have a picture of one of the trees. And I know we saw similar trees like this for Change Day, where people actually were invited to post their Change Day pledge up on the wall. And in this case, they were invited to talk about what matters to them and to post it on a leaf and make it visible for others to see. So a couple examples of sort of how this came to life in practice. Now, it's not limited to acute care or palliative care. I love these two examples. On the left-hand side, for those of you who don't speak Norwegian, this is What Matters to You Day in Norwegian. I actually do know that because I confirmed that with my mother and father-in-law who were born in Norway. But on the left-hand side, this was a sign that was put at one of the primary care clinics. So right when people came in the door, this is a sign that greeted them. It was a philosophy that the clinic adopted in terms of how they worked, how they were going to work together. About really inviting people to ask and tell people what mattered to them in their care. And so it was built right into how that clinic operated. On the right-hand side, they actually put what matters to you as a slogan that sat on the side of all the fleet vehicles with community care. So if people came to the house, they actually had this sitting on the side of their vehicles as well as, again, a reminder of how important this question is when we're providing care. So what is this all about and who's invited? So we basically invited anyone, either a patient or anyone who works with patients in health or social care, is really invited to participate. But we don't want to limit to that either. So, if you don't provide direct patient care, that need not stop you. So talk to your colleagues, talk to your friends, talk to your coworkers, and find out what matters. So we try to make it really easy. So we've created a website that lets you sign up and show your commitment to patient and family-centered care. And you can either sign up as an individual or sign up as a team or organization and let us know you want to take part in this on June 6th. Just a reminder that the site actually doesn't go live because you're getting the sneak peek today, but it won't go live until February 21st, but it'll be coming soon. And so what we're asking today is for you to join us to either start or invite a conversation about what matters on June 6th, 2017. And so when we think about this, we wanted to make it really easy for you. And so I'm going to hand it over to my partner in crime now, who's going to tell you about some of the resources that have been created to help do this. Go ahead, Danielle, and I'll throw you the ball.
Great. Thanks, Colleen. And thanks, Sonya, for a great presentation as well. So what we've done is there's a Getting Started kit, which goes through all about what matters to you and some examples and what patients in BC have said has mattered to them. So that's a great place to start to learn more about the campaign. There's also posters that we've created so that you can put them up all over your workplace if you'd like. We've also got pocket cards, so pocket cards for either your lanyards or just to have in your back pocket, literally, or in your wallet, and also bookmarks that have different types of questions on them. We've also got buttons. I've already got my button on here, but lots of buttons and some really great stickers, both for the provider, the blue one here in the middle, Tell Me What Matters to You, that's for providers, and then the green sticker, Ask Me What Matters to Me, are stickers for patients. And then soon, we will have T-shirts available for order. So very similar to Changed ABC, if your team or organization would like to take part and would like T-shirts, you'd be able to go to our website and order T-shirts, and we'll ship those all directly to you. We're also going to have, we have a video that we've created to promo What Matters to You, and we'll be launching that on February 21st. Hopefully you'll see it on one of the various social media channels that you follow, but that's also going to be it's about 90 seconds long, so a really easy way to share about the campaign, and has all the information that you'll need to promote the campaign in that video as well. Most importantly, though, we really want to hear about how the conversations go. It was so interesting reading some of the feedback from the different countries that have participated in What Matters to You, and that's what really got us excited, was listening to the impact that the conversations had on different providers. So if you have a conversation on June 6th or before or just after, please come to our website at What Matters to You ABC, and there's a form there where you can share your story with us, or if you're on social media, you can use the hashtag WMTY17 to let us know about how that story went for you and what impact that had on how you're providing care or how you're going about your day. So we really, really do hope that you'll join us in this campaign, and I'm going to pass it back over to Colleen.
Thanks. Thanks a lot, Danielle, for giving that overview of all the resources that have been created. I really want to pause and create the space for a little bit of discussion and conversation right now, whether about the presentation that we had in terms of really thinking about what matters. I actually have some questions up my sleeve for you, Sonya, I'd love to bring into this. And also for other people on the line, love to hear your reaction, your thoughts about this upcoming campaign, and if you have any feedback for us so far. So yet again, I welcome you to pop any questions in the chat box, or pop your hand up and we can unmute your line to create the space for you to ask any questions or have a little dialogue. We have a quiet group on the line today, so I'm going to give it a couple minutes. I really do encourage to take the time to put your hand up if you have any questions. And Sonya, you've made a comment in here, and it's hard to talk about things that matter. I'd love to build on that in a question for you. You talked about, the death over lunch, death over dinner. I'd love to hear a little more about how those went. What some of the biggest opportunities were for you doing that, and maybe what were some of the challenges of actually going off and doing that?
Well, I just thought about, it's so funny, I just did this little few-minute storytelling, and as soon as I was finished, I was thinking, oh, God, all that, everybody's just going to be thinking how cheesy it was so flaky and floopy, and it was all, I started doubting myself, and partly in reflection, I think that's because it's not typical for us to have these conversations, not only with the people closest to us, but certainly not necessarily in a professional context or in a workplace. And so I think it takes a minute. It takes a bit to push beyond what we're used to and dig into the stuff that's really meaningful. And I think that really came out in the death over lunch. I think people were really surprised by the invitation, weren't too sure. Some people were really interested really quickly, and other people, I think they're going to come to the second one or the third one. But I would say that the most powerful part of it is just watching how grateful people are. It's like there's a breath of, a big sense of relief to be able to talk about these things that we don't normally talk about, because it is what we're supposed to be focusing on, and so often we get distracted from it. So I would just, people probably are having thoughts in the back of their mind about, ways to participate in this conversation that may not feel that comfortable to come forward with. And I bet they'll be thinking about it again later today, too. So I don't know. I think it's just, we got to practice, and this is part of that.
Wonderful. Thanks a lot, Sonya. Are there any tips, practicing is one of them. Is there any tips you would give people going into What Matters to You Day in terms of having these conversations? Certainly yours is a very personal, meaningful one, but also, just in general, looking at What Matters to You Day, what are some tips you would give somebody taking that leap?
You know, and this really came clear to me when I took the School for Health and Care Radicals course a few years ago at the Quality Forum, so maybe you guys will have a chance to dig into it this year at Quality Forum as well, but really the idea of just trusting your instincts and not overthinking things. So really being willing to just take the leap, you know, move to the edge of your comfort level and say something that, you know, maybe the little birdie on your one shoulder is saying, you know, pipe down, leave that alone, don't talk about that here. Maybe quiet that one down and listen to the other voice on the other shoulder that's saying, you know, I kind of want to ask about how that person's feeling, or I kind of want to tell this person that I'm uncomfortable, or like just jump in, do it. Just, you know, call it out and use your words that are coming, even if they're imperfect or even if they're not totally formulated, is to be vulnerable. And in your being vulnerable, it creates the space for the people around you to do so. My mom was an amazing teacher in that way. I don't know how many times she, you know, hugged me when I was going through some type of a personal stress, either at school or in my work life or with my husband. And she would just say, you're not the only one experiencing this. Don't be so hard on yourself, you know? So I think if we take that lesson and just trust that if you're experiencing it, if you're feeling nervous or uncomfortable, chances are the people around you are as well. And if you can call it out and talk about it, it really brings those things that matter up to the surface.
Brilliant. Thank you so much for that, Sonya. Baljeet, I noticed you had your hand up. It's down now, but we're going to mute your line. Is there anything you wanted to add or any questions you wanted to ask?
Hi, Colleen. Can you hear me?
Hi, Baljeet. Thanks for coming today.
Yeah, thanks. Sonya, thank you for sharing your story. I'm sitting here with a colleague I've brought into the presentation, and we're not, we're in the lab here, and we're not clinical, but this is really speaking to us, and we're thinking about how do we bring this to our environment and have these conversations with our colleagues. Do you have any suggestions? Or does anybody have any?
Yeah. Go, Sonya, do you want to speak to that first, or do you want me to jump in there?
Sure. I mean, this is one of those things where I don't know that there is an easy, you know, an easy way to translate it into the different settings that we're in, but I think it's really about checking in with yourself and figuring out what you think is needed in the particular group of people that you work with, whether it's, you know, going for a walk and making some intentional time to talk about your families, or, you know, challenging a tension in a meeting that maybe people have been silent about. Or, I mean, it's really challenging to define it in other people's settings. I don't know if, Colleen, you may want to speak to it as well, but it really, I think, is just being willing to stay in the place of checking in with yourself when you're in various points of your day and in your work life. Yeah, I don't know if I can say more than that.
No, I think that's brilliant. I think well put, Sonya. I think I would add to that, too, is that, you know, it's really about what matters to you. So if you're non-clinical, you know, maybe you've got an opportunity to put a tree up in your unit and just invite each other to talk about what matters to each of you, you know, in terms of the care that you provide or the work that you do and what's important and why you chose to do that. I think there's lots of opportunities. Well, certainly it's an outward-facing campaign and a person and family-centered care campaign. We really do want to see what we can do to broaden it, to also look at the people who provide care in the system and what matters to them. And, you know, Sonya provided such a great example of that today about how she's taken her own personal experience, you know, experience of her mother and what mattered to her and applied it. So I would say, you know, invite those conversations. On February 21st, when the website goes live, all of those resources, getting started kits, et cetera, will be available for people to download or order. We can send some your way. If you're going to be attending the forum, we're going to have resources flowing that way as well. And so, you know, I really invite you to kind of share. And also, I would also ask Baljeet, and sorry, your partner that you've got there with you, I didn't get their name, but to welcome you to share what you do. Would love to hear about it. So Baljeet and Julie, would love to hear what you've done. So start with the people you work with, and then we'd love to hear back from you. Flip us an email, send us a note, pop something on the web page, and tell us how it went, and tell us what you learned, because that's one of the really interesting things we find is that as all of us go off and do this work, so much of the richness comes in each of our experiences as we translate this into practice. And so we really invite you to go off and do it and then tell us how it goes. So thanks for asking that question.
Can I just add one quick thing to that, Colleen? Be willing, I think for me, it's really being willing to not have the answer, to just, like Baljeet, and hi Baljeet, it's nice to hear your voice, but being willing to, maybe go into a staff meeting and say, I watched this webinar, there's this thing coming up and it's about what matters to me, and I don't actually know how to weave that into the work we do, but I sure, it resonates with me, and I wonder if we can start there. Because I think just not knowing is really okay, but being willing to say this is a priority for me or this is something that matters, maybe that's where you start.
Absolutely, and thanks for adding that. I think it's really good in terms of just giving some additional thoughts and just taking it where it goes. And maybe the people, your colleagues, will have ideas as well that they can build on. So thank you. Any other questions or comments? For those of you who maybe don't want to put your hand up, you're welcome to put any questions in the chat box. If you have any thoughts, feedback, we'd love to hear from you. We haven't gone live yet, so we'd love to hear other thoughts, other suggestions you've got for this campaign that will soon be coming down the pipe. All right. So I'm going to invite you right now to think about what matters to you today. And maybe with the check mark or the X mark, think, is this something you think that you might want to participate in? And so I'm going to get you to use the Webex and just put a check mark. If you think, yeah, I'm in, I want to do this, let us know if you think this is of interest to you. Oh, we got a nice check mark on the screen too. I love that big blue check mark. I'm going to frame that one. Here are your thoughts. So you're welcome to use the check mark either on the screen or in your chat box. We've got lots of check marks coming in both places. This is great, you guys. Wonderful. I love to see it. Now, the other question I have for you, thank you so much, everyone. I'm glad to see that response, is looking at what matters to you today. Is there anything else that you can see that would help you promote it? So for those of you, we've heard a lot of interest. One of the purposes of the Change Ambassador Network is a network, a place where the change agents around the province come together. We share our own learning. We share our own experiences. We share some of the campaigns that may be of interest to you. Is there anything else we could do to support you in this campaign? Is there anything else that you would like to see us provide to help pave the way for you to be successful? Maybe as people are thinking about that, you're welcome to put up your hand if there's anything you want to add or pop in the chat box. Fatima, I'd love to hear what you're saying right now. You're talking about, you're asking yourself right now, what matters to me? Love to hear you comment on that. I'd like to invite you to at least.
Hello, am I unmuted?
Hello, you are.
Hey, hey, hey everyone.
Hey.
Well, thank you so much for, I guess where my comment came from. First of all, thank you Sonya, thank you Colleen, thank you Danielle for putting this hour together. Is really, really great. And my comment comes from just the inquiry itself. So just by the very nature of seeing the question asked, what matters to you and what matters to me, and just the question being asked has sparked some things inside me that I'm thinking about, and now trying to reconcile and see and have it start with me. So what matters to me, and be better understanding and be more at ease with what's important to me before I go out and I ask others what matters to them. So I like to go internal first and then I go external, even though I'm very extroverted by nature. So that's where that comment comes from. So before June, or before February 21st, when the website goes live, and before we start rallying everyone else, I really want to understand what's my motivation behind this.
Thank you so much for sharing that. I think it's brilliant, Fatima, to kind of hear your thinking about it. I just noticed while you were talking as well, there's been a few questions coming in the chat box. I know some of them have been answered already in the chat box, but I just wanted to bring them to people's attention. Susan, you were asking to confirm we'll be able to access a video to share with our colleagues. Absolutely. As of February 21st, we'll be promoting a video as part of our launch, our virtual launch of What Matters to You Day. It'll be available on our website so that you can actually access it, download it, use it. And so that will be coming with time. So on February 21st, everything will go live and you'll be able to access everything. We're doing a bit of a quiet launch with you all today because you are many of the change agents of the province who touch this work. We know this work aligns with the patient and family-centered care work that's happening across the province and really wanted to bring it to you. So thanks so much for highlighting that. So the video will be coming. And we can actually also promote it in our Change Ambassador Network newsletter. And for those of you who don't subscribe to that newsletter, I did put the link into the chat box a little while ago. I'll pop it back up there again in a second if you like, just so that you can sign up for that and you'll get all the information about this campaign through that channel as well. I'm just looking at the time, and I wanted to know, is there any final questions or comments before we wrap up today?
Colleen, there's a question in the chat box too around patient, what will be the involvement from our patient partners in promoting? Maybe we can just speak to that.
Oh, thank you so much. I missed that one, so I really appreciate you bringing that to my attention, Danielle. Do you want to comment on it first, and then I can jump in?
Sure. So we absolutely would love and need patient involvement for this campaign. So we've partnered with the Patient Voices Network, and so all of the team at the BC Patient Safety Council who works in patient engagement for the Patient Voices Network has been briefed on this campaign and are thinking about ways and strategies that they can involve the patients within their areas. A lot of the resources that we've designed have been with the patients in mind, so whatever we've designed for providers, we've also designed for patients, so that patients can also order those resources and use those resources as well. And it's, I think, you know, we really do want to see patients involved as much as possible. So as some people said, it's sometimes hard to have this conversation, and sometimes, you know, we really do encourage even the patients to start that conversation sometimes if at all possible. Colleen, do you have anything else to add?
You covered it brilliantly, Danielle, and I would just add to that is that, you know, the patient partners have been a key part of developing the resources that have been created for What Matters to You Day. This has been done in close consultation with our partners. And then we'll also be doing promotions. So the Patient Voices Network Breakfast at the Quality Forum, for example, is actually going up on the Patient Voices Network Facebook page, et cetera. I do believe Carol is on the line today. I don't know if, Carol, if we can unmute your line and see if there's anything you want to add, or Carol or Ben. I notice you're both on the line and just really want to invite you to actually comment as well.
Hi, Carol, everyone. Can you hear me? It's Carol Stathers.
Sure can.
Okay, great. So I'm with the Patient Voices Network, and I work out of the Interior region. And I just put a comment actually in the chat box, and I was going to suggest that please sign up on the website, share back any conversations that you have with healthcare providers on how those conversations go for you. And it's okay to go in and initiate those conversations and then to share back. We're also talking a little bit about how we can engage our patient partners in the Patient Voices Network to help share those resources and get them out into the communities. So I've got a couple ideas of my own, but just maybe stay tuned and see how we can put out a little bit of a challenge to say, how can you help us share this?
Wonderful. Thank you so much for that, Carol. Great addition. Ben, is there anything else you'd like to add?
I don't think so. I think Carol covered it there very well, and as well as Danielle and you, Colleen. I was going to make a comment about the fact that patient voice has been represented in the planning, but you already covered that. So I think there's perfect alignment between the work that we're doing within the Patient Voices Network and this campaign around What Matters to You. And we're looking forward to being able to engage patients both in the rollout of the campaign, but then obviously encouraging and fostering more of those conversations at the bedside.
Exactly. Thank you so much. And I think it's really interesting. I appreciate you jumping in there, Carol and Ben. You've added a lot to the conversation. And I think the biggest thing is, well, what matters to you today, we've got resources for promoting this from the provider perspective. We're trying to get providers on board. We really want to encourage patients to invite the conversation as well and create the space for that if that's something you're comfortable with. And so the resources are really created for both groups, and we're really excited about that. Sonya put a note in the chat box as well that we are all patients, so even ourselves as we go into the system, how can we have the opportunity to also tell our own providers what matters to us in our care? So you've raised a good point there, Sonya. So the resources will be coming live, and we'd love to hear back from you as things progress. I think as Carol mentioned, tell us how it goes. So on June 6th, if you have those conversations or if you're out there promoting, share your stories. We'd love to hear how it's going. So who you talked to, how did it feel? We've got some questions placed on the website where you'll be able to enter those things, and we've tried to make it really easy for you as well. Sonya or Danielle, is there anything you'd like to add before we wrap up today?
Nope, just sending out a bit of cheerleading on behalf of my mom, and that we're all in this together, and that when you're feeling your heart beating a little bit because you're talking about something that may not feel like is, normal to talk about in a work context or a healthcare context, just follow your heart and really pay attention to what does matter to you.
Wonderful, thank you so much. Danielle, is there anything you'd like to add?
No, just thanks so much, everybody, for joining us today, and we can't wait to have you as partners in promoting this work.
I couldn't agree more. So I just wanted to lastly wrap things up to thank Sonya again for sharing such a personal story and how she has translated it into what matters to you. It felt like such a great story and such a great segue to talk about a bigger system view of what matters to you and how can we really invite this conversation and learn from Sonya's own experience and how we can apply it in the day-to-day work that we all do in really promoting and fostering patient and family-centered care. Last but not least, we do have a survey that will pop up on the screen at the end of today's call. We ask you to take a couple minutes to please complete that. We want to hear from you. We want to make these sessions useful for you. The other thing is as you start on this What Matters to You Day journey, we really want to hear from you. And we kind of earmarked a bit of an opportunity at our next CanBC webinar to talk a little more about this. So I'm going to seize the opportunity to mention that as well, is that our next meeting is going to be May 9th at 12:30. We're going to learn more about what matters in terms of talking about this campaign and some people's actions around this work, and then also just what's happening in the province around patient and family-centered care relating to this. So thank you again to Sonya for sharing your story. Thank you for everyone for taking the time to join us today. Watch for the newsletter, which will have the slides and the link to the video, as well as the wonderful information around today's webinar. And we look forward to talking to you all soon. So thanks. Have a great day, everyone.